Today we will discuss about the cardiac cycle, which is super high yield topic for the FCPS part 1 because more than 40 MCQs in the previous FCPS past papers comes from this topic. After completing the theory of the cardiac cycle, we will discuss the high yield point and the MCQs which comes in the previous past paper of the FCPS. Cardiac cycle divided into the 7 phases. The first phase is atrial systole. Second is the isovolumetric ventricle contraction. Third phase is rapid ventricular ejection. Fourth phase is the reduced ventricular ejection. Fifth is isovolumetric ventricular relaxation. Sixth is the rapid ventricle filling, and 7 is the reduced ventricle filling. So basically we will discuss each phase in detail. In this picture, the lower bottom changes are the ECG changes during the cardiac cycle. These are the venous pulse or jugular venous pulse changes during the cardiac cycle, and these are the ventricular volume changes during the cardiac cycle. These are the heart sounds, and these are the pressure changes which takes place during the cardiac cycle. The first phase of the cardiac cycle is the atrial systole, which represent here. During atrial systole, the ventricle contraction take place, and this phase is preceded by the P wave. P wave represent the atrial depolarization. So after atrial depolarization, atrial contraction takes place. This phase only, the atrial systole, contribute only the 20% of the ventricle filling. When atria contract, it causes two changes. First is increase the atrial pressure, which cause A wave production on the venous pulse curve. Second, when atria contract against the hypertrophied ventricle, then this produce fourth heart sound, which is not normally audible. Second, the 80% remaining ventricle filling is passive, not take place through atrial contraction. Atrial systole, this phase is the shortest phase of the cardiac cycle. Next phase is the isovolumetric ventricle contraction. Basically in this phase, in ECG changes start from the QRS complex. QRS complex basically represent the ventricle depolarization. After the ventricle depolarization, the contraction of the ventricle start. This thing is increase in pressure due to the contraction of the ventricles. When ventricle pressure greater than the atrial pressure, this lead to the closure of the mitral and tricuspid valve. This produce the first heart sound, which represent here, and the volume change, which is the isovolumetric. The volume is a constant. Second thing is the mitral valve closes before the tricuspid. Basically, the mitral valve closes before the tricuspid valve. This lead to the splitting of the first heart sound. Third phase is the rapid ventricular ejection. In this phase, the ventricle pressure continue increase. When ventricle pressure become greater than the aortic pressure, then the aortic valves open. Second thing, in this phase, rapid ventricular ejection phase, the volume of the blood decrease rapidly in this phase. Third thing, in this phase, rapid contraction of the right ventricle produce bulge in the tricuspid valve, which cause C wave on the venous pulse curve. And this phase end with the onset of the T wave. Pressure of the ventricle maximum in rapid ventricle ejection phase. And second thing, the onset of the T wave, which represent here, basically this represent the electrical repolarization of both ventricles. Atrial filling also begins in this rapid ventricle ejection phase. Ejection of the blood continue in this reduced ventricle ejection phase, which represent here, and ventricular pressure continue decrease, which represent here, and the ventricle volume also continues decrease because the blood is ejected from the ventricles. Second thing, the atrial filling continues. The flow of the blood is a continue in the right atrium or both atrium. This flow of the blood produce wave changes on the venous pulse curve. Phase of the cardiac cycle is isovolumetric ventricular relaxation, which represent here. In this phase, the ventricular pressure continuously decrease, and when this ventricular pressure becomes less than the aortic pressure and pulmonic pressure, then the both valves are closed. After the closure of the aortic valve, there is a blip in the aortic pressure tracing, which is called dicrotic notch or incisura. Second thing, in this phase, because of the isovolumetric ventricular relaxation phase, basically the closure of the valves, aortic and pulmonic valve, which produce second heart sound. Second heart sound is basically due to the closure of these two valves. The aortic valve closes before the pulmonic valve, and this leads delayed closure of the pulmonic valve lead to the second splitting of the second heart sound. So the frequency of the second heart sound is higher, but duration as compared to the first heart sound is less. Sixth phase of the cardiac cycle is a rapid ventricular filling. In this phase, the ventricular pressure continuously decrease, and when this pressure become less than the atrial pressure, the mitral valve and other tricuspid valves open. So in this case, the rapid flow of the blood from atria into the ventricle take place, and this produce the third heart sound. And aortic pressure also in this phase continuously decrease because the blood is ejected from aorta to the smaller arteries. Last phase of the cardiac cycle, reduced ventricle filling phase. It is also known as a diastasis. Basically, it is the longest phase of the cardiac cycle, and the ventricle filling continuously but at a slower rate. The diastasis also depend on the heart rate. For example, when heart rate increase, there is decreased time for the ventricle filling. So in this case, which lead to the decrease in diastolic volume, which ultimately cause decreased stroke volume. We will discuss about the past MCQs of the FCPS, which comes from the cardiac cycle. So let's begin. What is the mechanism of the splitting of the second heart sound? Basically, the second heart sound is produced by the closure of the aortic and the pulmonic valve. Aortic valves slightly close before the pulmonic valve, and the delayed closure of the pulmonic valve produce the second heart sound. The second MCQ is the S2 production, and in which phase of the S2 production takes place the cardiac cycle. So basically, the S2 sound is produced in the isovolumetric ventricular relaxation phase of the cardiac cycle. What is the mechanism? Is the closure of the aortic and the pulmonic valve. What effect on inspiration on the second heart sound? Basically, the inspiration cause delay closure of the pulmonic valve, because the inspiration increase the preload, in which lead to the delay closure of the pulmonic valve, and on inspiration we heard a single heart sound. Third MCQs, difference between the frequency of the first and second heart sound. Basically, the second heart sound is higher frequency and shorter duration as compared to the S1. And fourth MCQs is about the S1 sound. Basically, the S1 produced in the isovolumetric contraction phase of the ventricle, mechanism closure of the atrioventricular valves, which is the mitral and tricuspid valve. Basically, mitral valve closes slightly before the tricuspid valve, and this lead to the splitting of the first heart sound. The heart valve is a frequently asked question in the FCPS. So location of the mitral valve at left fifth intercostal space at the apex of the heart. Tricuspid valve left fourth intercostal space, left fourth and fifth intercostal space, and pulmonic valve second left intercostal space. Aortic is right second intercostal space. So basically you have to memorize these location for MCQs. Now, what is a dicrotic notch or incisoria? Basically this is the blip in the aortic pressure tracing occur after the closure of the aortic valve. So now we will discuss the when aortic pressure is is lowest and when it is highest. So aortic pressure is lowest in the isovolumetric contraction phase of the cardiac cycle and maximum in the slow ejection phase of the cardiac cycle. MCQs related to the venous pulse curve, which also known as a JVP curve, also known as a jugular venous pulse. So what is a wave? A wave is basically produced due to the atrial pressure, increase in atrial pressure due to the atrial contraction during the atrial systole. It is produced in the atrial systole phase of the cardiac cycle. Second thing is a production of the C wave. Production of C wave basically produced during the rapid ventricular phase, rapid ventricle ejection phase of the ventricle, in which contraction of the right ventricle lead to the bulging of the tricuspid valve, which produce C wave on the jugular venous pulse or jugular. Second thing is a V wave. V wave basically represent blood flow in the right atrium or blood flow from right atrium into the right ventricle, and it's take place in the slow or reduced ejection phase of the ventricle. Highest blood flow in the coronary artery in early diastole. Maximum pressure in the ventricle take place in the rapid ejection phase of the cardiac cycle. Preload is approximated by end diastolic volume. So what is the shortest phase of the cardiac cycle? Basic, the atrial systole. It is the last phase of the diastole. Second is the which of the following is the longest phase of the cardiac cycle? It is basically slow ventricle filling or the reduced ventricle filling. So now what is the mechanism of the fourth heart sound? Fourth heart sound basically produced by the vibration of the ventricular valve due to the atrial contraction. What is the mechanism of the third heart sound? The mechanism of the third heart sound is a rapid flow of the blood from the atria to the interventricle, and it may be the physiological and it may be the pathological.